Drink baking soda for 7 days. Your joints will feel like they're 20 again. How does baking soda affect the joints? And how can you use baking soda for arthritis and arthrosis? Watch the video until the end to discover how this simple ingredient can help treat joint diseases. And don't forget to like and share it with your loved ones. Joints are the movable connections in the musculoskeletal system, allowing us to move, walk, and perform various actions. Each joint is a complex biological mechanism that requires care. Problems occur in the joints due to metabolic disorders, inflammation, or injuries. Joint diseases range from arthritis caused by infections to ankylosis, joint stiffness. To better understand what can happen to the joints, let's look at their complex structure, a crucial biological mechanism for movement. Joints, also known as articulations, are formed when two or more bone surfaces come into contact, creating a connection between different parts of the body. Between these bone surfaces is a layer of flexible cartilage, which helps reduce friction and allows the joint to move smoothly and pain-free. This cartilage acts as a cushion, protecting the bone surfaces from wear and tear during movement. Around the joint, there is a joint capsule made up of ligaments and connective tissue. Ligaments are tough bands of tissue that help keep the joint stable and prevent the bones from moving too far apart, thus preventing the joint from dislocating. The connective tissue surrounding the joint helps support and nourish the joint tissues, maintaining the function and shape of the joint. Inside the joint, there is a special lubricating fluid called synovial fluid, which helps reduce friction between the bone surfaces and cartilage while providing nutrients to the cartilage. This fluid not only aids in smooth joint movements, but also helps maintain the health of the internal structures of the joint. However, certain conditions can affect a specific part of the joint or the entire joint structure. The most common joint-related problems include arthritis, inflammation caused by infections, or autoimmune reactions. Arthritis is an inflammatory condition in which the cartilage and surrounding soft tissues of the joint are damaged, leading to pain and stiffness. Arthritis can occur when bacteria invade the joint, or due to toxins released by bacteria causing inflammation. In addition, there is another form of inflammation known as periarthritis, which affects not only the joint, but also the surrounding tissues such as tendons, muscles, or the synovial capsule. This condition can cause swelling, pain, and restricted movement in the affected areas. Furthermore, osteoarthritis, also known as degenerative joint disease, is a degenerative condition related to the deterioration of joint cartilage quality. This disease often occurs due to metabolic disorders, salt deposits in the joint, or the thinning of cartilage over time. When the cartilage becomes thinner, the bones may rub directly against each other, causing pain, inflammation, and reduced joint mobility. This condition can lead to joint deformities and severely impact the quality of life. These conditions often cause intense pain, limit movement, and may lead to joint deformities if not treated promptly. When addressing joint-related issues, various treatment methods are applied, including medication, physical therapy, and traditional remedies. One popular and effective method used by many people is baking soda. Baking soda has the ability to reduce inflammation, soothe pain, and support the healing process for damaged joints. How does baking soda affect the joints? Baking soda, sodium bicarbonate, is an alkaline compound that helps neutralize acidity in the body, which in turn reduces inflammation and prevents the growth of harmful microorganisms. Here are the benefits of baking soda for joints. It restores the body's acid-base balance, promoting positive changes. Baking soda increases potassium levels in cells, which is essential for cell function. It reduces inflammation, neutralizes toxins, and kills bacteria. Baking soda boosts energy to tissues, improves metabolism, and promotes recovery. It reduces swelling by eliminating excess fluid. Baking soda also has pain-relieving properties, improves circulation, and supports lymphatic function. These features make baking soda a useful tool in supporting joint health during illness or after injury. Traditional healers have long used baking soda for its pain-relieving and anti-swelling effects on the joints. Recent scientific studies have shown the potential of baking soda in reducing systemic inflammation, an important factor in managing joint diseases like arthritis and osteoarthritis. A 2018 study published in the Journal of Immunology found that baking soda could trigger an anti-inflammatory response in the body by stimulating the spleen to produce more anti-inflammatory immune cells called macrophages. This activation helps reduce systemic inflammation, leading to decreased swelling and joint pain, providing relief from arthritis-related symptoms. Furthermore, baking soda has been shown to have a positive impact on metabolic processes, which are often disrupted in diseases like osteoarthritis, where joint cartilage deteriorates over time. By balancing the body's pH and improving cell function, baking soda can indirectly slow cartilage degeneration and improve joint function. In addition, using baking soda to alleviate symptoms is not limited to arthritis, but can also help with conditions like gout, which is characterized by the deposition of uric acid crystals in the joints. Baking soda helps reduce acidity, preventing the formation of these painful crystals and providing significant pain relief for gout sufferers. How to use baking soda for arthritis and osteoarthritis. Arthritis and osteoarthritis are common joint diseases that cause discomfort and reduce mobility. To cope with these conditions, many treatment methods are used, including baking soda, which can be applied both externally and internally. You can create baking soda baths for the joints, or the entire body, massage it into the affected areas, or drink baking soda. When using baking soda orally, start with a small amount and gradually increase the dosage. On the first day, dissolve 3 g of baking soda in 150 milliliters of warm water and drink it on an empty stomach. On the second day, drink the solution twice, gradually increasing the dose to 15 g, 1 tablespoon per serving, twice a day for 30 days. After completing the course, many patients report significant pain reduction and improved mobility in the joints and spine, reduced swelling, and lower skin temperature around the joints, with less redness in the affected areas. Additionally, overall health improves, blood pressure returns to normal, heart problems reduce, digestion improves, and kidney function is enhanced. Baking soda compress. Mix sea salt, mustard powder, honey, and baking soda evenly, then apply to the affected area, cover with plastic wrap and warm cloth, and leave overnight for 14 days. Baking soda and bread compress. Mix sour yogurt, black bread, and 10 g of baking soda. Let the mixture sit for 6 to 8 hours before applying it to the joint, leaving it for at least 2 hours, repeating this at least 2 weeks. Baking soda solution compress. Dissolve 2 tablespoons of baking soda in a cup of water, soak a cloth in the solution, and apply it to the joint. Let it dry and repeat 3 times a day for 10 days. Bran and baking soda compress. Grind bran in a coffee grinder, then soak 3 tablespoons in 100 milliliters of low-fat yogurt, and add 1 teaspoon of baking soda. Apply under plastic wrap and warm cloth for 2 to 3 hours, continuing for 21 days. Homemade ointments. Vaseline ointment. Mix 100 g of pharmaceutical-grade Vaseline with a teaspoon of baking soda and a tablespoon of honey, and rub into the affected joints. Butter ointment. Mix 50 g of butter with a teaspoon of baking soda and 5 drops of almond oil, and apply to the joints at night. Ointment for children. Mix 50 g of regular baby cream with a tablespoon of baking soda, add a drop of sage and peppermint essential oil, and apply 3 times a day. Hand and foot soak. Dissolve 1 tablespoon of sea salt and 1 tablespoon of baking soda in warm water, and massage the joints while soaking for 30 to 40 minutes. Full body bath. Add 200 g of sea salt and 200 g of baking soda to hot water, and take a bath before bed for 10 to 12 sessions, resting for 1 month between courses. Lifestyle changes to support joint health. While baking soda provides pain relief, managing arthritis or osteoarthritis requires a comprehensive approach. Combining baking soda therapy with gentle exercises like walking, swimming, and yoga can improve joint flexibility and reduce pain. Exercise helps improve circulation, delivering nutrients to the joints and reducing stiffness. A balanced diet rich in anti-inflammatory foods like leafy greens, berries, and omega-3 fatty acids can also effectively complement the benefits of baking soda. These foods help reduce systemic inflammation and support pain and swelling management related to joint diseases. Are there any side effects? Baking soda, especially in high concentrations, can cause skin irritation. It should not be applied if you have open wounds or skin issues. Avoid drinking baking soda if you have stomach problems, diabetes, kidney disease, liver disease, or if you are pregnant or breastfeeding. Always consult a doctor before starting any therapy with baking soda. Overuse of baking soda can lead to side effects like electrolyte imbalances, so it's important to use the appropriate dosage. In rare cases, consuming too much can lead to metabolic alkalosis, a condition that makes the body's pH too alkaline, which can cause muscle spasms, nausea, or irritability. Always monitor your body's response and discontinue use if any side effects occur. If you found this video helpful, please like, share, and don't forget to subscribe to the channel and turn on notifications to receive updates for our upcoming videos. Wishing you joy and good health.